Hi, good afternoon, viewers from sunny Stoke-on-Trent, working for the Combined Minds and imparting information regarding mental health issues in accordance to the Royal College recommendations, as there's no health without mental health. So in specific, we'll be talking about depression, but more so depression in the elderly, which is a massive, massive problem in the country, as there is an aging population that is obviously requiring a lot of care and help and treatment, including social care. So we'll start off with my first slide. What is depression? Professor Paul Gilbert is the author of a book called Overcoming Depression. He tends to state that depression is a very commonly misunderstood phenomena. It's sometimes not seen even as an illness. It affects about 350 million people worldwide, and according to some new data, 6 out of 10 people in the UK are suffering from the illness of depression. So 22% of men really, and 28% of women age 65 and over. So considering the elderly population, it can be a massive issue and a massive problem to mitigate against. As people go from the community into care, especially for the elderly, the rate and the instance of depression increases. Regardless, to say that it can affect any human being, regardless of their culture, ethnicity, gender, background, and not surprisingly, even horses get depressed, and their performance then declines, and so do dogs. So what is depression? Basically, it is a biochemical problem within the brain. So it's a change in the brain state. Lots of people do not see it as an illness, because I really could not show you this on a CT scan or on a test, but it's as much as an illness as heart disease or other illnesses, which can be obviously seen. This brings us to the next slide, and I'll just address some of the common problems and myths associated with the diagnosis of depressive illness. I must emphasize that it is an illness and not an individual's fault. It is not a sign of weakness or character. You're not weak as a person if you are experiencing depressive illness. Self-criticism, we've seen in various studies, is linked to the disease of depression, and maybe we'll towards the end address this as a treatment modality. Lots of people tell me that they think depression or depressive illness is not a treatable illness. Nothing is further from the truth from that. For vast majority of the people, depressive illness is a treatable illness that at least allows us, for individuals, to manage and enjoy their life. I'm going to be talking about the next slide, which really centers around causation of the condition of depressive illness. So personality and environment that one grows up also determines whether you're likely to develop depression or not. Genetic vulnerability is the key. There are loads of studies to suggest that genes play a very important role, and more often than not, we do try to seek a history of family mental health problems. There have been several studies to suggest the reared apart studies and the adoption studies from the Danish registers, as they maintain registers of identical twins. So if identical twins have been reared apart, the other twin that is not in the country, or was not in the country of Denmark and was away, also developed depressive illness or other psychiatric problems. So genes, I cannot emphasize, and more often than not, we see clusters of patients within one family. So in elderly especially, loneliness, social isolation, poor mobility, poor physical health, health challenges, life-threatening medical conditions like cancer, other chronic diseases like cardiovascular disease, hypertension, diabetes, dementia, and stroke can all increase the incidence and prevalence of depression as an illness. Thyroid function tests, if they are impaired, especially if the thyroid function is underactive, the thyroid gland is underactive, then you can have symptoms very similar to depression, or it can mimic the diagnosis of depression. Infections, especially in the elderly, can really tip the balance and patients can present with very similar symptoms of depression, either post-virally or post-bacterially. Alcohol and drugs, lots of people when they are depressed or even when they are happy try to use alcohol and drugs as a method of coping. It is fair to say that alcohol really genuinely does not help, as it is a depressant of one's mood, although temporarily one may feel a bit better. Depression can occur in the early stages of dementia, so we sometimes have, as clinicians, have to differentiate between dementia and depression. And there's a condition known as depressive pseudodementia, which essentially means that depression can mimic the picture of dementia. So in good clinical hands, this differentiation needs to be made. We talk about the symptomatology of depressive illness and what you may experience in terms of symptoms. So the first one is really psychological symptoms of depression. So it's basically the mental health symptoms. So you can have persistent mood or sadness. It is important to realize that all of us can become low and depressed, but if the symptoms are lasting for more than 2 weeks and if they are persistent, then one should seek help or consider the diagnosis of a depressive illness. So if you are experiencing loss of interest or reduced pleasure in life, feeling upset, feeling numb or empty, feeling hopeless or helpless, if you're anxious and worried about small little trivialities of life, if you're intolerant of others and becoming irritable, then I suppose you need to look at the fact whether you might be suffering from a depressive illness. Again, other important symptoms are impaired concentration and attention, which can then lead to memory problems, especially in the elderly. Sometimes people may experience excessive degrees of guilt, and they may kind of think that they've done something really wrong in their lives and that God or whoever is trying to punish them. So it's a disease that is not without its own set of mortality. So you can have thoughts of self-harm or recurring thoughts of death and suicidal thoughts. So for suicide, really, there is this level of prevention and timely treatment that can actually determine the course of completed suicide. We go on to the next set of symptoms, which are physical symptoms. So people can have physical experiences of distress that are related to the fight and flight response or anxiety symptoms. They can, after a while, feel very tired, exhausted. They may lack in energy. They can become tearful. They may have disturbed sleep patterns. In depressed patients, they have a tendency of waking up in the small hours of the morning, something like 3 a.m., and they're unable to go back to sleep. And at that time, they're ruminating about and questioning the meaning of their existence. So in the elderly more so, you can also have unexplained aches and pains. You're likely to move or speak more slowly, and clinically we see that these patients have a low monotonous tone, monosyllabic, with monosyllabic sentences. The other physical health problems is, people lose their appetite. So appetite is not linked to the stomach really. The desire to eat is within the center, within the brain. So it's all about desire. So if you are depressed and low, the desire to have food also reduces, and consequently people can then lose weight, or sometimes they can overeat and gain weight. So do not tend to care for themselves as they would normally, and especially lack of self-care we see in older people as a more prominent symptom. Lots of older people also complain of constipation because the gut motility actually reduces. More so in the younger people, there is reduced desire to have sexual activity or to approach their partners. Fatigue is another symptom that we often see, more so in older people, when they feel constantly tired, energetic, and not having the desire to move or to do things that they would ordinarily do. So this brings on to the next slide, which is primarily about the social symptoms of depression. So when people are depressed, I think they can have a decline in their academic performance, they can have a decline in their work performance, they can experience difficulties at home, they may not want to go out, or may have they would not engage in their social calendar or see their friends. They may neglect their hobbies or interests. Things that they've previously really enjoyed doing, they do not have much interest. A worst thing is that some patients can withdraw to a degree where they can isolate themselves from others, and this is something that is common as a behavioral symptom in older people. So this brings us to the fact as to, I've explained the symptoms to you, so this brings us to the point as to how to manage a depressive illness. It's a huge and a vast subject, but I'll just try to see if how briefly I can give you a concise rundown of adequate treatment. So depression from a psychological perspective is closely linked to the relationship that you have with yourself. If you are more critical of yourself, not in touch with your thoughts, feelings, and behaviors, all this can influence and cause depression. So a good starting point is really to go back and see the checklist and to see if you have these kind of symptoms. Maintain a diary. A symptom tracker will definitely help. So use that for a period of 2 weeks, and you may kind of see whether there is any particular pattern that emerges or not. This again brings us to the next bit, treatment. Now we know that depression or depressive illness can be mild, moderate to severe. So if there is treatment available for all three conditions, for mild depression or mild depressive disorder, we normally try not to prescribe medication, but maybe it is dealt more effectively with psychological treatment modalities. Moderate depressive disorder, we can give medication. There are certain myths about medication that I would want to clarify in terms of antidepressants, that antidepressants are addictive, they'll turn you into a zombie, you will be no good, you'll be constantly sedated. Nothing is further from the truth than that. So we have loads of medication which do not cause drowsiness or sedation, and those sort of medication we tend to give in the morning, and most commonly used are according to the National Institute of Clinical Excellence guidance, including drugs like SSRIs, and the more sedative ones are drugs like mirtazapine and trazodone. So there are various groups of medication which, and so we have a wide range, and it's a big, huge industry, these antidepressant medication. And some go as far as suggesting that this is by far the fourth largest industry, the pharmaceutical company. And the future is bright as they are continue to do more and more research. So there's some tips to help you combat depression. So a good acronym is known as BASE. So BASE simply means that you look at your body care, you look at your achievements, you look at connecting to others, and you look at enjoyment. So I cannot emphasize more on the fact that you need to have adequate sleep, not too much and not too little. When you're sleeping, it's like charging your body and your brain. It's just like you put in a charger to your iPhone. Eating healthily and regularly, having adequate rest time, limiting smoking, caffeine, drinking, and drugs. Lots of us kind of think that smoking helps you to calm down. It's totally to the contrary. It can genuinely make you very anxious. Achievements. So celebrate your achievements, whatever small achievements you have. Practice gratitude. Have realistic, achievable goals. Get your calendar in. Write a few things down that you could do for the day, whether it's studying, working, or exercising, or all of it. Connecting to others, absolutely vital. We know that people who have a good social structure, who are social, who go out, tend to generally live longer and healthier. So messaging a friend, going to a support group, going for a coffee, so whatever really takes your fancy in terms of how you connect to others, whether that is through sport, group sport, or something at home with others, or going out for a meal with your friends. I do appreciate that these are very small little things, but these things genuinely help people to feel a lot better. And so whilst taking medication in some ways is a passive way to get better, but making lifestyle changes. I know you're going to say, Dr. Karim, it's very hard to do all these things. I'm not motivated, I have no interest, but I can guarantee you'll feel definitely better once you do start on doing small little things, setting up small goals every day. Coming towards the end of the talk, there are several strategies that can help you other than what I've mentioned. One is mindfulness. Essentially, mindfulness is staying in the present, not mulling too much about the future and not kind of thinking too much about the past. So here and now, enjoy the small little things that you are doing. Cognitive behavioral therapy is another treatment modality that will help you restructure your thinking in addition to medication. So I thank you very much at the end for bearing and listening to me. I hope this talk has been helpful, and hopefully I shall see you soon sometimes.